Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
This demonstration will be concerned with introducing you to certain basic fundamentals of mounting stone casts on a semi-adjustable articulator. The articulator is a device which enables representations of patient's dentition to be mounted, which will then allow us to do work on the patient's models while the patient is not present. This view shows our goal for today, that is, correctly mounted upper and lower casts on the Hanau Articulator. In this view, we can see the patient's teeth closed in centric occlusion and also a representation of the condyle of the mandible. The articulator represents certain of these anatomical features. As you can see with the articulator superimposed upon the side view of the patient's head, the condylar elements of the articulator represent the condyle. The mounted casts represent the patient's dentition. Now we have the various components that we use in order to arrive at our goal of a successfully mounted case. We have the facebow with its bite fork. We have an accurate upper and lower cast of the patient's dentition. We have pink baseplate wax and 2 mounting rings along with the articulator. The first step is to secure the facebow registration from the patient. In doing this, we are correlating the patient's condyles with his maxillary arch. This has nothing to do with capturing any relations concerning lower teeth. This particular facebow is an arbitrary facebow in that although we are looking for the relationship between the maxillary arch and the hinge axis, it's called arbitrary because we are using an average anatomical measurement known for the distance between the external auditory meatus and the location of the hinge axis on the patient. It's much easier to secure this, much easier for a dental student or a dentist to do without the aid of an assistant. The first step in securing the facebow is, after the ear rods are inserted in the ears, the numbers on either side of the facebow are brought in such a position as that the number on each side is the same as the number on the other side. This centers the facebow on the patient. This particular patient, the number on either side is 62. This number is strictly relative and has no anatomical meaning. The next step in securing the facebow is the use of the bite fork on which we have pink baseplate wax. We heat this in a water heater approximately at 138 degrees Fahrenheit for just a few seconds in order to uniformly heat the surface of the wax so that we may get indentations of the patient's upper teeth in the wax. This is centered in the patient's mouth using the notch on the anterior portion of the facebow rod. A slight pressure is placed underneath the bite fork to secure indentations of the cusps of the upper teeth. We now can remove the bite fork from the patient's mouth, and I would like for you to note that the indentations that we have on this wax are very shallow, and when we place the maxillary cast into this registration, only the cusp tips will be in wax. It's always a good idea with any wax registration to chill the wax, bring it back to at least room temperature, and then try the registration back in the patient's mouth to show that there was no distortion while removing it. Always check for rock and see if it fits right back on the same way as the first time. We will use cotton rolls placed between the lower teeth and the bite fork so that the patient can close and help secure the bite fork while we use our hands to do other things. Now take the face bow, which we have previously centered on the patient. We left one side set at the number that we arrived at. We will place it over the bite fork, back into the ears. Tighten up the other side. We now have the face bow recentered, the bite fork in place. We tighten the screw, and it's a good idea to have the patient hold one side of the bite fork so that the torque of tightening the screw does not distort our registration. We can now remove the face bow from the patient in one piece. We now have taken a bite fork and an ear rod face bow, made it into one piece, giving us the relationship between this patient's maxillary arch and his condyles. The next registration that we will take from the patient is a protrusive registration. This registration we will also use pink base plate wax. In this registration, we are trying to capture the position of the mandibular teeth to the maxillary teeth while the patient has his mandible protruded. The base plate wax is rolled into a flat rope and then made into an arch shape configuration. Placed in the water heater, while we will now always have the patient practice this movement before we attempt to capture it in wax. Close your teeth together now. In this position, the patient has his teeth close together in centric occlusion. Close. Now, if he moves his mandible forward approximately 4 to 6 millimeters, this is the position that we want to capture. The only way to capture this is to place the softened wax between the teeth, then chilling it, then we can set the articulator to only move in the position which lets the teeth be held in this position. The softened horseshoe of base plate wax is placed on the upper teeth. Held with one hand while the other hand guides the mandible back to the previously determined protrusive position, and then the patient is instructed to close his teeth into the wax but not through the wax. Now just hold this position for a moment. At this point, the wax is returning to a lower temperature and is getting hard. We now can remove the hardened registration from the mouth, check to see how our progress is. This wax bite is not acceptable, and I'll try to point out why it's not. For one thing, the wax is much too wide. If this wax registration were placed on a cast, it would be very hard to keep this portion of the wax off of the soft tissue areas of the cast. Also, we have much too much wax labial to the registration also. And thirdly, it extends too far to the distal of the last molar. These are mistakes that you will make probably in your first attempts to do this type of registration also. We'll now make another one and show you proper way and hope for a better result. At this point, we're again softening a piece of base plate wax, but in this instance, I'm going to use only half a sheet of wax in an attempt to cut down the width of the final registration. I'm going to roll the wax in a much smaller rope in hope that when we get the registration finished this time, that it will only be covering the occlusal surfaces of the teeth. Once again, I'll roll it into the arch shape, and I'm going to make it a little bit smaller this time than the other one so it won't extend distal to the last molars. Let it heat for a moment, and we'll practice the movement one more time here. Close your teeth together now in centric occlusion and protrude about 4 to 6 millimeters. Open just a little. All right, this is the point at which we're going to return with the softened wax. This wax softens quite readily when the proper temperature is used, which is 138 degrees Fahrenheit for the Swiss dent wax. Press it onto the maxillary teeth. Once again, we'll protrude the mandible a little and close right into the wax. Once again, we don't close through the wax. We want a tooth apart position. This is a jaw-to-jaw position. And you realize at this point, this type of registration could be made also on a patient that does not have teeth, since we're capturing a position of the mandible to the maxilla. The wax is now returning to its hard state, and we can now have the patient open. Carefully remove the wax and chill this so that we can try it back in the mouth to be sure that removing it didn't cause distortion. Now close back into the indentations. It does not wobble, so we now consider this open, a acceptable bite. I would like to show it in conjunction with the other one that we had. The first one is on the left, and the one we're going to use as the acceptable one is on the right. You can see that this one is much wider, has the potential to cause impingement problems on parts of the cast we do not want. This one only covered the occlusal surfaces, has no wax sticking out to the labial of the teeth, and has indentations on the lower part from the lower teeth, upper part from the maxillary teeth. We now have the two registrations, the facebow and the protrusive, that we need to mount our casts on the articulator, and the remaining portions of this procedure will be done in the laboratory. One of the most important points prior to actually mounting the cast on the articulator is to make sure, prior to each mounting, that the articulator is properly zeroed. This includes, as you will remember, that the horizontal condylar guidance is set at 0, the lateral condylar guidance is set at 0, the incisal guide table is set at 0, and the top of the incisal guide pin is flush with the upper member of the articulator. Also, You must be sure that there is no side-to-side wobble at the rear of the upper member of the articulator. When actually placing the articulator on the facebow on the articulator, first step now is to lower the horizontal condylar guidances on both sides to 70. The reason for this procedure is only in this position is the pin on the centric lock on which we will place our ear rod in the same position as the external auditory meatus is to the condyle in the patient's skull. We will next place the cast support onto the lower member of the articulator. The purpose of this is to aid in supporting the bite fork as we place our upper cast in position. An important thing to remember is that plaster is actually corrosive to metal surfaces, and it is always prudent to place Vaseline on the surfaces which the plaster may come in contact with. I'm placing this now in position where the mounting ring for the upper cast will go next. As you tighten the mounting ring into position, you make sure that it is firmly held and that it is flush with the upper member of the articulator. Next, we actually position the facebow on the articulator. Once again, as we did in the patient, we center the facebow by making the numbers on the slide rules on either side the same. In this case, it is about 69.5 on each side. As you can well imagine, this articulator will not be the same width as all patients, and in doing this, we are actually only centering the facebow. The two condyles are two of the 3 points of reference that we use in mounting the facebow on the articulator. The third point of reference on the Hanau Articulator is the notch on the incisal pin. As you will notice, there are two notches. This is the case on most Hanau articulators, and we will use the lower notch. The lower notch is aligned horizontally with the incisal edges of the upper teeth when placed into the wax registration. I can show this better with the cast actually in place and the pin closed down. The incisal edges are even with the lower notch on the articulator. Now, you make certain that the cast that you have placed in here fits well without rock prior to getting it ready for the actual mounting. You will notice that I have already scored the top of this cast. This is another thing that you cannot do too much of, so to speak, in that plaster does not act like glue and must have mechanical retention to hold the cast to the articulator. Also, to make this retention better, we moisten the top of the cast prior to putting the plaster on so that the dry stone of the cast does not soak the moisture from the wet plaster that we're going to place on top of it. You only have to moisten it for a few seconds, and if you will notice, I placed it in the bowl of water so as not to get the occlusal surfaces wet. There's always a chance that this may allow the teeth to soften, and then their occlusal relations with the lower when it's mounted would not be proper. You now close the articulator again and estimate the difference between the mounting ring and the top of the cast so that you can get a close idea how much plaster you do need to fill this space. We're now ready to place the plaster between the mounting ring and the cast. Do this by mixing the powder with the water, spatulating until we have a creamy mix. You will note throughout this procedure, I make every effort to keep the plaster away from parts of the articulator that it is not absolutely necessary for it to contact. Once again, this is because the articulator is a precision piece of machinery, and plaster, being alkaline, is not good for the metal finishes on these articulators. We make certain that the retentive grooves that we cut in the cast are filled with plaster. Then we make a little mound of the softened plaster on top of the cast in order to fill the space that exists between it and the mounting ring. And now we can close the upper member of the articulator and fill in the holes in either side of the mounting ring with plaster, adding to our mechanical retention of the upper cast. It's always good at this point to do as much smoothing as possible while the plaster is soft, because once the plaster hardens, and then it becomes your job to make the articulator look neat and the plaster mounting smooth, you have to do it with chisels and sometimes blasting powder. Don't be afraid to get your fingers into the plaster at this point. We want this to look neat. It's much better to have plaster on your hands at this point than on the articulator in places where it shouldn't be. We now will allow this plaster to set before proceeding to mount the lower cast. We now have let the plaster reach its maximum hardness and have done a little more sprucing up on the plaster that's holding this upper cast to the mounting ring. The next step is to get the articulator ready for the lower cast, and it's the same almost as the upper. We always put Vaseline on the parts where the plaster is going to be touching the articulator. We're stressing this, showing it twice in this procedure for you so that you will not forget this. The lower ring can now be placed on the articulator. Once again, you want to make sure that it is flush with the lower member and that it is securely fastened. To mount the lower cast, the articulator must be turned upside down, and to hold the articulator in a proper position, we use a articulator mounting stand. The lower cast is now placed against the upper cast in centric occlusion. This is maximum interdigitation of the teeth. There will be one point at which the cast fits and there is no rock. There are other procedures to mount casts in different positions, such as centric relation, which we will not consider at this point. Once again, we're going to wet the cast and show you that we have deep retentive grooves cut in the cast to help hold the plaster. Again, you will note we did not get the teeth wet because at this point we are actually putting the cast together, and this is where, if the teeth were wet, there might be discrepancies added to this mounting. Now, you close the articulator, estimate once again the amount of plaster that is needed, and at this point some provision has to be made in order to hold the cast in this position while the articulator is being jostled around during the plastering. Red rope boxing wax is a good joiner for these casts put at the buccal surfaces. This helps hold the casts together. An alternate method is to use a popsicle stick held in position on the upper and lower cast with sticky wax. This, of course, is done bilaterally so the cast will not rock. We're now ready to mix plaster once again and secure the lower cast to the articulator. We're now ready to set the posterior control mechanism of the articulator using our protrusive registration which we obtained from the patient. You will note that if I place this wax record on the upper teeth and close the articulator, that the lower teeth do not fit into this registration at the same time that the upper teeth do. The reason for this is that this registration was taken while the patient's mandible was in a protruded position. In order for the lower teeth now to fit into this registration, the upper member of the articulator must be moved backwards, simulating a protrusive movement on the articulator. Now, in order to make the casts fit better into the wax record, you will note that if I raise and lower the horizontal condylar inclination, the casts rock forward and backward. There is a point at which there will be no rock, and this we choose for our horizontal condylar inclination. First, it's done on one side, and the articulator is turned around, and it is done on the other side. To the position where there is no rock, and the mechanism tightened. Always go back now and check the first setting to be sure that it is the same after setting the opposite side. This now sets the horizontal condylar inclinations. The next setting is to set the lateral condylar inclinations, which is on the bottom member of the articulator in the posterior area. This is done using the formula that can be found on the bottom of the articulator. You do not need to memorize this formula, as it is inscribed in metal on the lower portion of the articulator. The LCG stands for lateral condylar guidance. This equals the horizontal condylar guidance divided by 8 plus 12. We now have the posterior control mechanism of the articulator set, and it is time now to set the anterior portion of the control mechanism, the incisal guide table. I have switched casts in this instance because this set of casts, it has a more perfect incisal guidance for demonstration purposes. The first procedure that is done is to move the cast into a protrusive position so that the incisor teeth are end to end. At this point, you will note now that the pen is not touching the incisal table. It has been moved posteriorly. The table is now set by raising the back part of it up until it touches the pen. And this sets the protrusive portion of the table. The screw under the table is now tightened to secure this position. In order to set the lateral incisal guidance, the cuspids on one side are moved to a cusp tip to cusp tip position. And then it can be noted that once again the pen is not touching the table. Here again, we raise this side of the table up into a point where it touches the pen, and this sets the lateral guidance on this side. It is repeated for the other side of the articulator, moving the cuspids to an end-to-end position, and then raising the table up once again to touch the pen. The purpose of the incisal guide table at this point now is to allow the articulator to be moved into protrusive or into lateral excursions, and the table touches at the same time the teeth do, and the teeth are not worn. This now completes the setting of the Hanau Articulator. You will recall the steps involved were the securing of the records from the patient, the facebow record, and the protrusive registration, along with an accurate set of upper and lower casts.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.